How does a CORT scan differ from MRI for diverticular disease diagnosis? Imagine trying to get a clear picture of what's happening inside your abdomen. Doctors have two main tools for this: CORT scans and MRI scans. When it comes to diagnosing diverticular disease, especially diverticulitis, these tools each have their strengths and limitations. A computed tomography scan, or CORT scan, is usually the first choice for doctors. It provides detailed cross-sectional images of your abdomen quickly and accurately. Because of its high sensitivity, a CORT scan can confirm if you have diverticulitis, show how severe it is, and detect complications like abscesses, perforations, or fistulas. It's fast, often taking just a few minutes, which is very helpful if you're in pain or need urgent diagnosis. Plus, CORT scans are widely available in hospitals and emergency rooms, making them accessible for most patients. The downside is that CORT uses ionizing radiation, which can be a concern if you need multiple scans over time, especially for younger patients or pregnant women. On the other hand, magnetic resonance imaging, or MRI, uses magnetic fields and radio waves instead of radiation. It produces images with excellent soft tissue detail, making it very good at showing inflammation and other subtle changes in tissues. MRI does not expose you to radiation, so it's safer for repeated use and preferred for younger patients or those who need ongoing monitoring. However, MRI scans take longer, often 30 minutes or more, and can be uncomfortable for some people, especially if they're claustrophobic or have metal implants that are incompatible with MRI machines. Additionally, MRI machines are less common and more expensive, which limits their use as a first-line test in many hospitals. In terms of accuracy, both imaging methods are reliable, but CORT scans are generally considered the gold standard for diagnosing acute diverticulitis because they quickly provide detailed information about the presence and extent of inflammation and complications. MRI is gaining interest, especially for patients who need to avoid radiation, but it's usually reserved for specific cases or follow-up imaging. In summary, if a doctor needs a fast, accurate diagnosis of diverticulitis, a CORT scan is typically the best choice due to its speed, availability, and detailed images. MRI offers a radiation-free alternative with excellent soft tissue contrast, but it's less practical in emergency settings because of longer scan times and higher costs. The decision on which to use depends on individual patient factors, including age, health status, and the urgency of the situation. Always consult with a healthcare professional to determine the most appropriate imaging method for your specific case.